I would like to express my appreciation for the opportunity to participate in the ICUrology video interview. I'm Sungjin Kim from Hallin University, Gangnam Sacred Heart Hospital. Today, I will present our study titled Metabolic Syndrome and its Components as Independent Risk Factors for Nocturia. Metabolic syndrome is a cluster of metabolic abnormalities such as central obesity, hypertension, dyslipidemia, and hyperglycemia. Given its high prevalence and systemic impact, metabolic syndrome has become a major public health concern. Accumulating evidence suggests that nocturia may also reflect underlying metabolic dysfunction. Several studies have reported associations between metabolic syndrome and LUDS, but many were limited by small sample sizes, lack of diversity, or heterogeneous definitions. Importantly, previous research often evaluating metabolic syndrome as a single entity and did not fully separate the effects of individual metabolic components. Therefore, our study aimed to clarify whether metabolic syndrome and each of its components independently contribute to nocturia using a large, nationally representative dataset. We analyzed data from 8,518 adults aged 20 years or older, drawn from 5 cycles of the survey. Nocturia was defined as two or more nighttime voids, and metabolic syndrome was defined according to NCP-ATP3 criteria, requiring three or more abnormal components. We performed multivariable logistic regression analysis, adjusting for demographic and behavioral covariates. In addition, restricted cubic spline analysis was used to explore potential nonlinear relationships between each metabolic component and nocturia. Overall, 23.3% of participants had metabolic syndrome and 29.6% reported nocturia. Participants with metabolic syndrome were significantly older, had higher BMI, waist circumference, and triglyceride levels, and had a high prevalence of obesity and hypertension compared with those without metabolic syndrome. These differences were statistically significant across nearly all variables. Metabolic syndrome was independently associated with nocturia, with an adjusted odds ratio of 1.387 and a 95% confidence interval of 1.236 to 1.557. We also observed a clear dose response relationship. As the number of metabolic components increased, the risk of nocturia rose progressively. Among the five components, waist circumference, fasting glucose, and blood pressure showed relatively stronger associations with nocturia, although the effect size remained modest overall. These results suggest that metabolic abnormalities contribute consistently and meaningfully to nocturia risk, even if the magnitude of association for each component is not large. RCS analysis revealed linear relationships for waist circumference and systolic blood pressure. In contrast, nonlinear patterns were observed for diastolic blood pressure and fasting glucose. Sex-specific analysis showed distinct metabolic patterns, in particular, the impact of waist circumferences in men and the impact of triglyceride levels in women. The association between metabolic syndrome and nocturia remained consistent across most age groups, except among younger men aged 20 to 40 years, where the association was not statistically significant. Our study has several limitations. First, nocturia was assessed using a single self reported questionnaire item, which lacks validation against clinical tools such as bladder diaries. Second, residual confounding is possible due to unmeasured or misclassified variables. Finally, the cross-sectional design limits causal inference. Future study using prospective cohorts, detailed medication data, and validated nocturia assessments will be important to clarify the causal pathways. In conclusion, using nationally representative data, we found that metabolic syndrome is an independent risk factor for nocturia in both men and women. All five metabolic components were significantly related to nocturia, with central obesity, fasting glucose, and high blood pressure showing the strongest associations. Lastly, the observed sex specific differences suggest that metabolic profiles may contribute differently to nocturia in men and women. These findings underscore the importance of considering metabolic health in the evaluation and management of nocturia. Thank you for your attention.